my other guest, Natasha, you've been highlighting for us your interest in a recent study which suggests that getting poor quality sleep could increase someone's chances of developing more than 170 health conditions. Extraordinary. I should stress, though, that at the moment that the link, or the clear link, between poor sleep and the risk of getting these diseases is still kind of to be absolutely established. But the research looked at data involving about 90,000 patients in the UK over 7 years. So there's quite a lot of data there. What did you make of it when you saw it?
Well, I mean, I think my first thought was that, we're all trying to eat healthy, to get exercise, and to, be taking care of ourselves as best as we can. But it's really difficult to get a good night's sleep often if we're working really hard. I'm sure everybody here working on this program was up pretty early. I was up early, and lack of sleep does affect just sort of your ability to function, but then it becomes a little bit worrisome that it's linked to all these different health issues. And I wondered, what kind of sleep is good enough? How many hours do you need? I mean, there's just so many questions about sleep because it's such a big part of our lives.
It's amazing that we don't understand it more, isn't it? Given, as you say, how big a part of our lives it is.
Yeah, definitely. I mean, it's something that I think I complain about a lot, that I haven't gotten enough sleep, or did I get enough sleep, or am I going to be able to, function throughout the day? But it's sort of a mystery whether or not, just keeping your eyes closed, for example, resting, is that good enough? Is meditating good enough? Is just napping good enough? I mean, there's so many of us that are just struggling to fall asleep, that suffer from insomnia, and what a terrible impact that has.
Well, I reckon we've got someone who does know a bit more about sleep than certainly me. It's Lindsay Browning who's on the line, who's a UK-based sleep expert. She's a chartered psychologist and neuroscientist, and she holds a doctorate in insomnia from the University of Oxford. Lindsay, tell us about the connection between sleep and disease, and how fast that research is developing.
Yeah, so it's absolutely undeniable that getting a good night's sleep helps to keep your risk lower of many, many diseases. But to get fixated on, oh my goodness, if I don't sleep well, I'm definitely going to get cancer and dementia and heart disease, is really unhelpful, because lots of research shows that not getting enough sleep increases your risk of various diseases. Exactly how much risk, when, obviously developments are constantly happening, but it definitely increases your risk. But that doesn't mean it increases your risk from 0 to, say, 10%, because we all have a baseline risk of certain diseases. Whether we live a perfect life or not, we have an innate risk of developing cancer, say. So if your baseline risk of developing cancer is 30%, for example, and not getting enough sleep increases your risk by 10%, that means you now have a 33% risk of developing cancer. And I think we get caught up on thinking that a 10% increase in risk is really scary, but actually it might be a smaller increase in your baseline risk than you think. Does that make sense?
It does. I mean, is there, people will want to know, is there a way of mitigating this? It's all very well say get more sleep, but that's kind of easier said than done for people who struggle with sleep.
Absolutely. So my job is to help people who can't sleep well to improve their sleep. And just like eating well, exercising well, all these things help us to be healthier and happier. So I want people to do the best that they can to get a good night's sleep, but also to not freak out that the occasional poor night's sleep, or if in different seasons of our life, we have young children, we have a baby, we're going through a stressful time at work. Of course, we're not going to be able to sleep well at that point. So we have to just accept that we will all go through periods of poor sleep, and that's not the end of the world. But we want to do things that will increase our risk of increase our likelihood of getting a good night's sleep. So we want to go to bed at the same kind of time each night and get up at the same kind of time each morning to have a regular sleep window. Because if we sleep at different times, sometimes we go to bed really, really early, sometimes we sleep in super late, that actually affects our circadian rhythm and means that we're not as healthy. We want to have a wind down time before bed to make sure that we're calm and relaxed, because if we are busy working as hard as we can and we stick the laptop down and think, right, well, I have to go to sleep right now because I need to get my 7 hours of sleep, we haven't had time to let our brain relax and calm down, and we can't just fall asleep on command like that. And making sure that your bedroom is dark, it's cool enough, that you have a comfortable mattress, all of these things mean that it's more likely that we're going to get a good night's sleep. But sometimes we won't get a good night's sleep for whatever reason. Maybe we're stressed, maybe we're ill, and that's okay.
Natasha, I don't know if you suffer from insomnia yourself, but does any of that sound good advice?
No, definitely. I mean, I have the worst sleep habits. I can't even get into all of them. Sometimes I take a nap at 8 p.m. For 20
Gosh.
minutes, which is horrible. But one of my questions, though, which I had already referred to, but if I'm just resting my eyes, sometimes I can't fall asleep. I'm just resting my eyes and in bed. Is that good enough?
So, sleep, what happens to our brain when we are actually asleep is really amazing. And our body is regulating hormones, it's repairing our body. And simply lying there with your eyes closed isn't going to have the same benefit as actual sleep. However, if you're lying in bed resting and that helps you to feel physically better and able to cope the next day, then that's okay. But if you're lying in bed, not sleeping, and you're getting frustrated about that, and this is what people with insomnia do all the time, they lie in bed for hours just trying to go to sleep or just thinking, well, I just need to lie here and try to force sleep. And that just makes you more anxious, more frustrated. You keep checking the time, which makes you even more annoyed. You're like, oh my goodness, I've been lying here for 2 hours now. If you're lying in bed, unable to sleep and frustrated about it, I would really recommend that you get up out of bed and go and sit downstairs in the lounge, read a book for a little while, give yourself a break from trying to sleep and failing, and then go back to bed again, because that reset often helps to enable you to fall asleep much more easily. But lying in bed with your eyes closed, resting, in the short term isn't the end of the world. But if this is happening all the time, I would recommend that you maybe try and get up and do something about that.
Yeah, definitely. Do you have any just quickly on meditation? Does that help?
Again, meditating is a really great way of calming us down. It's restorative in different ways. We all need time during the day when we just stop, and the world is 24/7 busy, and we never have time to let our brain just relax and think. So meditating has got a whole host of benefits with it. But to say that it's the same as sleep, again, isn't accurate, because during sleep we have light sleep, we have deep sleep, we have REM sleep, which is rapid eye movement sleep, which have specific benefits. And when you're meditating, you're not sleeping, so it's not the same thing.
No, well, it's something that I've always been trying to do if I can get into a sort of a meditative state. So in terms of if you're taking overnight flights, which I often have to do because my parents live in the US, is there any advice about that? I mean, it's pretty impossible to sleep sitting up.
Yeah, absolutely. Unless you're lucky enough to have lots and lots of money and be in the left-hand side of the plane. Yeah, so we have to just accept that we're not going to sleep brilliant on a plane. And again, that's okay, because a night of really poor sleep isn't the end of the world. We just get to our destination, carry on with our day. What I would say is if you're going west to the US from the UK, then when you arrive at your destination, try to make sure that you get outside later in the day to get some natural daylight exposure in the late afternoon, early evening, because that will help your circadian rhythm, help give you that light to help you to produce melatonin a bit later and stay awake a bit later. And then when you return back to the UK, you want to be doing the opposite thing. So when you arrive in the UK, get outside early in the morning to get bright sunshine when you're traveling east, because that again helps you to mitigate or reduce your jet lag as much as you can.
Of course, if you live in the US, you can buy 1/2 of melatonin over the counter if you want to. Not that I'm giving advice, but Lindsay Browning, thank you very much. And Natasha, that's absolutely fascinating.